I found the event quite inspirational.
It's been fascinating, very interesting.
It's good that we've all now got a common view about what we're trying to achieve.
We need to empower our staff to work as one team.
To really think about our own individual behaviour as leaders.
It really fundamentally challenges how we've approached things in the past.
This is a different approach. In the US Wakefield Vanguard, we're trying to use the best examples that we can find globally to help us push our new model of care. And one of the challenges we've got is creating truly integrated community care.
You understand our perspective on how the world, business in particular, should work, based on our experiences in the military.
The event is around understanding in a bit more detail the team of teams concept developed by the McChrystal group and how we can apply it to the work that we're doing with the Vanguards.
Stanley McChrystal, a four-star general in the US Army, was faced with a similar challenge on the battlefields of Iraq. He had lots of highly professional individuals, but they couldn't defeat the terrorist enemy, and the reason was very, very similar. Siloed organisations not sharing information and not trusting each other, not being able to work together. So he created the team of teams approach.
We all essentially have a common goal, but we work in silos to try and achieve those goals. But if we can work as individual teams into one big team, it must make things much easier.
McChrystal broke down those silos, flattened the hierarchy, and they found that they were able to win that battle. And so we want to transfer that learning into our implementation of integrated community care. We were challenged to get up before dawn and do a physical training exercise, which is a little bit unusual for our health colleagues. We did some team games to do a little bit of team building. I think some of us learnt that we had particular leadership qualities that we didn't realise we had, and we recognised that the only way we could solve these problems was by working together.
It's been really good. I think we've been able to actually learn from what's happened in the Army and the FBI and apply it to what we're trying to do, but actually then work through some of these issues ourselves. So we've actually spent some time working up what it is we're trying to achieve, what type of information we need, what type of people we need in our fusion cell, in our hub. So as well as learning, we've actually done some practical stuff that would be really useful.
They challenged us to take on roles in a simulated exercise. Groups of us took on being CIA, Delta Force and Navy SEALs, and the groups were given packs of military intelligence, and the idea was to take on a role and actually work out how best to achieve the mission. And what we learned was it really works well if you're sharing information and not keeping it to yourself.
It's been great to work with some real experts on the field to think about concepts that translate and can transfer to us, and that's been profound, I think, amongst us all in relation to the sort of challenge that we're giving each other and the challenge that we're providing ourselves with.
The feedback we've had from the delegates has been absolutely fantastic. I think some of them came with a little bit of scepticism and weren't quite sure how the sort of military message would translate into health.
It's exposed me to a world of military which I'm not exactly used to and which I had some conflicting thoughts about beforehand, but which has actually been very interesting. And it's also confirmed actually a lot of my own thinking about how you work across different teams and different organisations.
Everybody has really recognised the parallels between the two scenarios. Each chief executive that's here now has committed to how they're going to change their organisation to refocus it and support the creation of our team of teams in our community hub.
I've certainly taken some things away that I'm going to reinforce with my teams, but also some new concepts that I want to introduce to see that we can keep it evolving and moving forward.
Well, we're hoping that this will have an almost immediate impact. It's coincidental that we're now in a position where we're constructing our community hub, and that hub will house our fusion cell and it will house our information hub, and the learning that we've got will be immediately brought through into the workforce. We will be creating really a new culture, I hope, with a shared mission which will start to provide a type of care which wraps around the patient.
I think the event really opened my eyes in terms of the way we need to work going forward, not just in individual organisational silos, but using the team of teams approach, and particularly relevant to the Connecting Care hubs, an environment where we need to empower our staff to work as one team.
We're hoping that we'll be able to become more proactive, start to intercept and deal with developing health issues before they get to the crisis point. So we're hoping that by adopting this method, we'll reduce hospital admissions quite significantly.
We can save on resources, we can save on time, we can save on money.
Communicate better to my employees to make sure that we can get the right people functioning in the hub, getting the right results.
What I've picked up has really reinforced my understanding.
It's massively applicable to everything that we do, and understanding that the traditional hierarchies are not the things that bring about change. It's not about the military, it's about the shared lessons together.